Now it's time for the case study segment, starting with fluid volume deficit. Miss J is an 80-year-old client admitted to the emergency department with reports of dizziness and episodes of lightheadedness when she stands up too quickly. She reports flu-like symptoms or manifestations with vomiting and diarrhea for the past 3 days. Oh, snap. Given the current scenario, which assessment data will be the nurse's priority to collect first? So go ahead and pause the screen and try your best to answer this question in about 60 seconds or less. Okay, let's break it down. Now, before answering any question, always think about the key words in the assessment data. So let's look at the key terms. Dizziness, lightheadedness when she stands up too quickly. So remember, this is orthostatic hypotension, our big test tip, that low blood pressure and dizziness upon standing. So the low blood pressure is priority here, since this can kill the client via hypovolemic shock, that's severely low blood pressure, making the heart unable to pump enough blood supply to the body. And the vomiting and diarrhea for 3 days, this is huge for fluid volume deficit, resulting in severe dehydration. Now the question asks for which assessment data is priority to collect first. So always think for priority questions, think about what can kill this client the fastest. So if you're only to check one thing, what would be the priority? And in this case, it's heart rate and blood pressure. Just think about the ABCs here: airway, breathing, and circulation. So in this case, circulation is a cardiovascular assessment. This is critically important to save this client's life, as low blood pressure can kill this client the fastest via hypovolemic shock. Now moving on, upon assessment, blood pressure is 82/48, and the heart rate is 110 beats per minute. Oh my goodness, 82/48 blood pressure is super low. So let's go ahead and call the nurse. Wait a minute, you are the nurse. So this client is on the verge of total cardiac collapse with that hypovolemic shock. So the question states, what does the nurse suspect as the underlying cause for the client's abnormal vital signs? So go ahead and pause the screen and try your best to answer this question. Now for the correct answer, fluid volume deficit. So remember, low blood pressure is from low fluid volume, specifically with clients that have been vomiting and having diarrhea for 3 days. This client obviously would have fluid volume deficit, so we'd expect that low blood pressure from that low fluid volume. Okay, moving on to question 3. What additional assessment data does the nurse expect based on the client's underlying problem? So once again, pause the screen and give yourself about 60 seconds to answer this question. All right, let's break this down. So before answering, always think about the patho behind the manifestations or signs and symptoms. The body has low fluid volume, so naturally the body's going to present low and little and even shriveled up. So we expect the body to be low weight, low blood pressure, and even weak thready pulses from that low fluid inside the vessels. And as far as labs, you already know that if the body is dry, then the labs appear high. So weight loss is the first answer, because remember, clients with fluid imbalances, weight loss means water loss. And we expect dry mucous membranes, of course, because dehydration dries the body. And weak pulses, those low little pulses from the low fluid volume. And increased body temperature, because when the body is dry, then the temperature is typically high. And lastly, increased hematocrit, because as we know, when the body is dry, then the labs appear high. Now moving on to question 4. What is the underlying pathophysiology for the client's hypotension and increased heart rate? So once again, pause the screen and try your best to answer this question. All right, let's break it down now, y'all. Okay, before answering, remember the key term we used for compensatory mechanism. The body's trying to create balance and make up for the missing fluid, right? So the heart will pump faster and move the little blood it has around the body to perfuse the organs. So the correct answer here, the client is hypotensive due to decreased circulating volume, and the heart rate is increased as a compensatory mechanism for the decreased volume and tissue organ perfusion. Yes, remember, the heart is working overtime here, trying its best to pump the little oxygenated blood it has around the body. Now lastly, question 5. What is the underlying pathophysiology for increased hematocrit in clients with fluid volume deficit? So once again, pause the screen. You got 60 seconds. Try your best. All right, let's answer this question. So hopefully, before answering, you remembered hemoconcentration is an indication of dehydration. Remember, that blood is very concentrated. Basically, the blood is turned to mud, that thick blood, because when the body is dry, well, the labs appear high. So the correct answer, hematocrit and possibly other electrolytes will appear falsely elevated because of hemoconcentration due to the decreased circulating volume. Serum osmolality is also increased due to hemoconcentration. So yes, increased osmolality means increased thickness of blood. Remember the memory trick. The blood is turned to mud. Now moving on to the case study for fluid volume overload. Mr. W is a 50-year-old client with a history of congestive heart failure, who is being seen in the clinic today due to a weight gain of 4 pounds over the last 24 hours. Oh snap, that's a lot. Upon assessment, 2+ pitting edema is noted in both ankles. Okay, so huge key words here for worsening heart failure. So, question number 1. Given the scenario, which assessment data will be the nurse's priority to collect first? So go ahead and pause the screen and try your best to answer this question in 60 seconds or less. Okay, before answering, always focus on the key words and see what it's telling you about the client. So the first key term here is congestive heart failure. Remember, when you see heart failure, always think HF for heart failure as HF for heavy fluid in the body, as the heart fails to pump blood forward. And again, think weight gain is water gain, specifically with the heart failure clients. So again, the key numbers that you should write down is 2 to 3 pounds in 1 day. So this question states 4 pounds in 24 hours. Whoa, that is way too much. This is definitely worsening heart failure, aka heart failure exacerbation. Now the next key term, or key number rather, is 5 pounds in 7 days. But this question talks about 24 hours. Now the last key term in the question is 2+ pitting edema. Remember, that waterbed skin from the heavy fluid. Now the question asks for which assessment data is priority to collect first. So again and again, for priority questions, think what can kill this client the fastest. So if you were to only check one thing, what would be the priority? So in this case, it would be blood pressure. Because remember, high blood pressure is very deadly. We're talking hypertension that is 140 systolic or more. This can lead to the hypertension crisis of 180 systolic, huge stroke risk. Okay, now look at this next part. The blood pressure is currently 158/98. Okay, that is way over 140 systolic. It's creeping up to that hypertension crisis, right? So question 2, what does the nurse suspect as the underlying cause for the client's abnormal assessment data, including edema, weight gain, and increased blood pressure? So go ahead and pause the screen and try your best to answer this question in 60 seconds or less. So let's break this down. Well, just remember your memory tricks here. So weight gain is water gain. For our HF, heart failure clients, we have to think HF, heavy fluid in the body, as the body fails to pump blood forward. So the correct answer is fluid volume excess secondary to exacerbation of congestive heart failure. Now moving on to question 3. Which pathophysiological process is responsible for the client's pitting edema? So once again, pause your screen and just do your best to answer this in 60 seconds or less. Okay, let's break this down. The key term here is pitting edema, which is that waterbed skin, from all that high fluid pressure being pushed out of the blood vessels and into the surrounding tissues, called the interstitial space. So the correct answer is increased hydrostatic pressure. Yes, again and again, increased volume causes fluid to be pushed out of that vascular space and into that interstitial space, resulting in edema. Okay, now for question 4 in our case study. What additional assessment data does the nurse anticipate for this client? So once again, pause the screen. You got 60 seconds. Good luck. Now let's break it down. So once again, think about the patho here before thinking about the manifestations or signs and symptoms. So the body has high fluid volume, right? Like a big bulging water balloon. Naturally, the body will present big and bulging, with big weight, big blood pressure, and big bounding pulses. And as far as labs, you already know the patho. We have less concentration of particles in the blood as fluid dilutes all the blood. So once again, the memory trick is when the body is liquidy, then the labs are low. Remember those low liquidy labs from hemodilution, that very diluted watered down blood, which I call hemodilution. Very low labs. Okay, now looking at our answers here. Bounding pulses, which we would expect from a lot of fluid, and decreased labs. So decreased hematocrit, decreased serum sodium levels, as well as decreased urine-specific gravity. So once again, when labs are low, the body is liquidy, a very dilute body here. Now moving on to question 5. What is the underlying pathophysiology for decreased urine-specific gravity in clients with fluid volume excess? So once again, pause your screen and you got 60 seconds. All right, let's break this down. So always, before looking at the options or thinking about the answers, always use the key terms in the question. So decreased urine-specific gravity, you remember decreased weight, or basically low weight, like gravity, right? And fluid volume excess, we have too much fluid. So again, you have to think diluted blood from too much fluid. Very light liquidy urine, that low weight from that fluid dilution. So the correct answer is in clients with excessive fluid volume, there's an excess of very dilute urine with a decreased specific gravity. So now you can see how all the manifestations come together if you simply know the patho of what's happening in the body. So remember, always think of the patho first and then look for the signs and symptoms. All right, that wraps it up. Thank you so much for watching. Don't forget to take your... Now moving on to the case study for electrolytes. So the nurse is caring for a client with the primary medical diagnosis of acute renal failure, secondary to treatment of a urinary tract infection with a nephrotoxic antibiotic. The client's morning basic metabolic panel, the BMP, reveals the following abnormal data. So sodium is 135, potassium 6.5, calcium 7.1, and phosphate 5.3. Wow, a lot of numbers there and a lot of keywords. So question 1, which electrolyte levels are out of normal range according to the client's BMP? So go ahead and pause the screen and try your best to answer the question in about 60 seconds or less. All right, so let's break this question down and let's see which values are out of normal range here. So as stated before, you should write down and write out these normal values at least 10 times per day the week of your exam so that you can memorize them. All right, so here we go. Normal sodium, that Na, is supposed to be 135 to 145. Now the BMP shows 35. Okay, cool. We're normal, but barely normal. Now potassium, that K+, normally between 3.5 and 5.0. So it's 6.5. Whoa, okay, that's super high. Remember, potassium pumps the heart and the muscles. Huge risk for heart dysrhythmias. Now, in terms of calcium, that's Ca+, normally between 9.0 and 10.5. So we have a 7.1 here. That is pretty low. And we know when calcium is low, well then phosphate will be high, since they work inversely. So phosphate is 5.3, which is high, as expected, because normally it's 3.5 to 4.5. So the correct answer is K, or that potassium, that is high, hyperkalemia, and calcium that is low, that hypocalcemia, and phosphate is high, that hyperphosphatemia. Now moving on to question 2. Which assessment data will be the nurse's priority to collect first according to the above electrolyte abnormalities? So once again, pause the screen and try your best to answer the question in about 60 seconds or less. All right, look at the key words here. The assessment data that is priority to collect first. So once again, any priority question, always think what kills the client the fastest. So in this case, we have potassium that's high, calcium that's low, and phosphate that is high. So we know that the 3 P's of potassium, remember, P for potassium is priority since it pumps the heart muscles. So with high potassium, we have high pumps. Huge risk for cardiac dysrhythmias like VFib and even cardiac arrest. Very deadly. So the answer is a heart rate and rhythm to collect. The client is at a high risk for dysrhythmias due to that hyperkalemia, that high potassium. So once again, just remember the 3 P's of potassium. This is high potassium, which means high pumps of the heart. Now moving on to question 3. Which additional assessment data does the nurse anticipate in the client with hyperkalemia? So once again, pause the screen and try your best to answer this question. All right, so let's break it down. This question's asking for additional assessment data for hyperkalemia, that high potassium. So once again, think high pumps for high potassium. And remember, your top 3 here. We have peak T waves with ST elevation and severe VFib and cardiac arrest, as mentioned before, and hypotension and bradycardia as the heart cramps up from that high pumping from that high potassium. Now, neuromuscularly, it'll be high as well, with increased DTRs, paralysis and paresthesias, that tingling, and even profound muscle weakness. And in the GI, we have high pumps as well, so diarrhea and hyperactive bowel sounds. So in this case, the correct answer is paresthesia, that numbness and tingling sensation, muscle weakness, hypotension, and increased DTRs, those deep tendon reflexes. So remember, high potassium means high pumps. Now moving on to question 4. What assessment data does the nurse anticipate in clients with hyperphosphatemia, that high phosphate? So once again, pause the screen. You got 60 seconds. Try your best. All right, so let's break this down. Always before looking at the answer options or even considering to answer, look at the key terms here. Remember, hyperphosphatemia is that high phosphate. And always consider what you know about phosphate. So in this case, we know that phosphate and calcium work as an inverse relationship. So with high phosphate, just think low calcium signs and symptoms. So the top 3 signs and symptoms that you should know is trousseaux and tetany, as well as chavostics or just vostics, and even weak B's, so weak bones, blood, and beats. So the correct options is tetany, chavostics or vostics, and trousseaux, which is that arm twerk with the blood pressure cuff on. And lastly, question number 5. What is the underlying pathophysiology behind this client's hypocalcemia? So as you can see above, look at the case study and focus on the key words here. So let the question help you. So go ahead and pause the screen and once again, try your best to answer this question in about 60 seconds or less. All right, so let's break this down. This question is asking, what is the root cause of this low calcium, that hypocalcemia? Well, let the question help you here. The key term is that the client has acute renal failure, which is basically broken washer machines of the body. So the body cannot clean the blood and drain excess phosphorus out of the body and into the potty. Naturally, phosphate will go up, making it high, which in result makes calcium low. Now looking at the answer. Due to the client's acute renal failure, the client is unable to excrete phosphorus readily, leading to a state of hyperphosphatemia. Calcium and phosphorus have an inverse relationship, leading to hypocalcemia, that low calcium, in these clients. Exactly. So now you can see how knowing the patho first will ultimately help you understand what's going on in the body and finding the correct answers. Moving on to the 5 practice test questions for fluid balance. So question 1. The nurse is caring for a client with fluid volume deficit, secondary to a 3-day history of vomiting and diarrhea. Which set of data does the nurse expect upon initial assessment of this client? So go ahead and pause the screen and try your best to answer this question in about 60 seconds or less. Okay, let's break it down. Before looking at the options, consider the key words in the question here. The first key term is fluid volume deficit. So just think, fluid is low in the body. We have a deficit of fluid. So think dehydration from low fluid in the body. And we can think of hypotension and weak pulses. Basically, the body doesn't have enough fluid inside the blood to cause big bounding pulses, right? So it's going to be weak. And weight loss, because weight loss is water loss. Fluid weighs a lot. As well as poor skin turgor, because as you know, when the body is dry, well, the skin is dry as well. And as far as labs, when the body is dry, well, the labs appear high from that concentration of blood, that really thick blood. Now, the next key term is 3 days of vomiting and diarrhea. Oh, snap. The electrolytes are going to be low here, or basically depleted, because as you know, where fluids flow, electrolytes go out of the body and into the potty. So the question is asking here for a set of data that you, the nurse, should expect upon initial assessment. So once again, think of the top 3 signs of dehydration: hypotension, weak pulses, and high lab values. Because when the body is dry, well, the labs appear high. Now, looking at the answer options. Option A, weight loss, hypertension, and decreased sodium. No, this is completely wrong. Weight loss is actually correct, but hypertension is wrong. It should be hypotension. And remember, if one part of the answer is wrong, well, then the whole answer option is wrong. Now, B is correct. Weak peripheral pulses, orthostatic hypotension, that low blood pressure, and increased hematocrit. Yes, this is perfect. Once again, the top 3 signs of dehydration is hypotension, those weak pulses, and high lab values. So once again, when the body is dry, just think the labs appear high. Now, options C and D are incorrect. So for option C, bradycardia, bounding pulses, and weight loss. So no, this is incorrect because bradycardia, that slow heart rate, isn't right. It should actually be tachycardia, that fast heart rate, as the body's trying to move the limited blood supply it has around the body for perfusion. Bounding pulses, no, it should be weak and thready pulses. And weight loss, this one is correct. But again, remember, if one part of the answer is wrong, well then the whole thing is wrong. And lastly, D, crackles in the lungs, low blood pressure, and weight gain? No. Crackles in the lungs are found when there's fluid volume overload, that fluid in the lungs that fills up the lungs, causing that bubbling, crackling sound inside the lungs. And low blood pressure is correct, but not weight gain. It should be weight loss. So once again, remember, weight gain means water gain. And here we're looking for water loss, that fluid volume deficit. Now moving on to question 2. The provider orders isotonic IV fluids to be infused at 100 milliliters per hour on a client. Which specific type of fluid will the nurse choose for this client? So once again, pause the screen and try your best to answer this question in about 60 seconds. Okay, let's break it down. Before looking at the options, always consider the key words here. So the first key word is isotonic solutions. Remember, the top two tested are 0.9% sodium chloride, that normal saline, and LR, that lactated ringers. So this is more of a knowledge-based question. But if you know the other solutions, then it could be easier. So remember, hypotonic solutions, we have lots of numbers. So lots of fluid inside the cell. So as you can see, all the numbers here, we just have a lot of numbers, 4, 5, 2, 2, 5, and 3, 3. And on the other side of hypertonic solutions, we have very little numbers, so very little fluid inside the cell. So just look at the numbers. A bunch of 3s, 10s, 5s, not a lot of numbers as compared to hypotonic solutions. But that was a little side note. So once again, isotonic solutions, just remember 0.9% sodium chloride, that normal saline, and lactated ringers. So looking at our answer options here, option A would be incorrect. Dextrose 5% in lactated ringers. Oh man, this one is tricky, but it's wrong. It's not an isotonic solution. So don't let the lactated ringers trick you here. This is actually a hypertonic solution, since the dextrose makes it a thick, sugary solution with many solutes, classifying it as a hypertonic. Now B is incorrect as well, because sodium chloride 3% is hypertonic solution. It has little numbers, right? And option C, also incorrect. Sodium chloride 0.45% is a hypotonic solution. A lot of numbers. So option D, sodium chloride 0.9% is correct. This is our top tested isotonic solution. Now moving on to question 3. The nurse is caring for a client with a history of congestive heart failure, who presents with new 2+ pitting edema in both ankles. In a client with congestive heart failure, what is the underlying etiology for peripheral edema? So go ahead and pause your screen and try your best to answer this question in about 60 seconds. Okay, before you look at the options here, I know this is a little bit tricky, especially if you haven't seen the video on heart failure yet. So let's review those key terms. Congestive heart failure. Anytime you see the word heart failure, just think HF for heart failure as HF for heavy fluid all over the body. As the heart fails to pump blood forward, it now backs up into the body and lungs from increasing fluid pressure. The next key term is new 2+ pitting edema in the ankles. So anytime you see the word new, sudden, rapid, or even abrupt, this typically means a critical client, as things are getting worse. So pitting edema is that soggy, waterbend looking skin, as heavy fluid fills up the body and now accumulates in the legs and the peripheries. Now this question is specifically asking the underlying etiology, or basically the cause of peripheral edema. So again, before looking at the options, just think about it here. What is causing this peripheral edema, this waterbed looking skin? Well, as mentioned before, it's heavy fluid pressure all over the body. Or in fancier terms, hydrostatic pressure. So hydro meaning fluid, and pressure, well, just meaning pressure. So option C is the most correct. But let's break down each one to explain the patho of why the others are wrong. So option A, decreased colloid osmotic pressure. Now this sounds like a word salad, right? But this is wrong, so let's break it down. Decreased colloid means less colloids inside the blood to attract fluid. So osmotic pressure is the pressure applied when fluid is attracted. This typically is seen with clients with low albumin, like clients with liver disease and cirrhosis, or even renal disease, where the loss of albumin occurs. So remember, albumin attracts water via colloid osmotic pressure. So without albumin inside the blood, while fluid is not attracted into the blood vessels. And thus, fluid just leaks out of the blood vessels and into the body. Now, option B is incorrect because increased capillary permeability is very tricky, but very wrong. So let the name help you here. Increased capillary permeability. We have very leaky capillaries, the connection between the arteries and veins. Now, this is typically seen with severe inflammation or tissue damage, like with severe burns. Next is option C. This one is our correct option. Increased hydrostatic pressure. So just think increased fluid pressure. That hydrostatic pressure, because remember, hydro means water. And D is incorrect. Obstruction of lymph system. No, this was pretty close though. There is no obstruction of the lymphatic system in heart failure. Only increased fluid pressure. All right, moving on to question 4. The nurse is admitting a client who has a diagnosis of fluid volume overload due to renal failure. The client has generalized edema and reports a weight gain of 3 pounds over the past 2 days. Which assessment data should the nurse collect first? Okay, pause the screen and try your best to answer this question. Now let's break it down. So always, before looking at the options, let's focus on the key words here. So the first key word is fluid volume overload. Just think a big old fluid-filled body. So we expect the client to have edema, that waterbed skin, from that excess fluid. The next key term is weight gain. Remember, weight gain is water gain. And the big key term here is 3 pounds in 2 days. Wowza. So remember the key numbers. 2 to 3 pounds in 1 day and 5 pounds in 7 days is not good. So wow, this client is gaining fluid very quickly, soon to become a critical client, as rapid fluid means rapid filling of the lungs. Basically, the client's going to be drowning in their own fluids. So before looking at the options, always look at what the question's asking. Assessment data to collect first. So remember, first means priority. So for the priority, think what kills this client the fastest, or basically, what kills this client first. Or just think, if I was only to do one thing, what would I assess to save this client's life? And what would it be? Well, in this case, it's ABCs, airway, breathing, and then circulation. So answer option A would be the most correct, assessing the breath sounds. Now, this is the most correct as breathing is critical. This should be assessed first, as airway and breathing are always assessed first. But specifically for this client, as fluid is filling up the body and soon the lungs as well. So rapid fluid, remember, this means rapid filling of the lungs, called pulmonary edema. It's very, very deadly, as the client can drown in their own fluids. Now, B, C, and D are all incorrect, but let's break it down. So B, the blood pressure. This one was very close, but it's incorrect. This is a circulation assessment. So if there were no options for airway and breathing, then this would be the assessment to do. And C, weight is not the priority over breath sounds. But daily weights are very important to assess because remember, when weight gain, we have water gain. And D, the heart rate. Again, this is a circulatory assessment, so it's incorrect because it doesn't take priority over breathing. Now, moving on to the last question. A client is receiving an infusion of 3% sodium chloride to replace low serum sodium. Which assessments will be priority for this client or any client receiving a continuous infusion of hypertonic IV fluids? So go ahead, pause the screen, and you got 60 seconds to answer this. Okay, before looking at the options here, focus on the key words. 3% sodium chloride, that hypertonic solution. Just think of a very hyper person who is very skinny. So, in the same way, we get very skinny cells that are drained of all their fluid into the bloodstream. And now we have way more fluid inside the vascular space, the blood vessels, leading to fluid volume overload, as all these cells are being squeezed for their fluid. Now, the question is asking which assessments will be priority. Again, when you see priority questions, just think what kills this client the fastest? Well, in fluid volume overload, a very high blood pressure will kill the patient. So monitor blood pressure. The key manifestation is hypertension crisis. Remember, a blood pressure over 180 systolic, huge risk for a CVA stroke, as all that pressure pounds against those tiny little blood vessels within the brain. So option A would be incorrect. Neurochecks. Now, this would be correct, but only if it was hypotonic fluid, where cells puff up like a little baby hippo, those hypotonic fluids, right? That would indicate swelling of the brain. So that's why we do neurochecks for hypotonic. But this question is about hypertonic. So B, blood pressure. Yes, this is the most correct. Because remember, what kills the client first? Well, in this case, it's a CVA stroke from that hypertension crisis. Now, C and D are incorrect. Because C, the blood glucose, this solution doesn't have any dextrose in it. So glucose would not be affected here. Now, if the question stated that the client had a sugar problem like diabetes and was on insulin drip or something, then it would be totally different priority. And D is incorrect because peripheral edema, that waterbed looking skin, does not take priority over blood pressure here. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love. Okay, now for practice questions on electrolytes. So question number 1. The nurse is caring for a client with a potassium level of 2.8. Which potential complication is priority to monitor for this client? Once again, pause the screen and try your best to answer this question in about 60 seconds or less. Okay, let's break this question down. Always look at the key terms first. The question gives us a client with a potassium of 2.8. So potassium is normally 3.5 to 5.0. So 2.8 is super low. The question asks for the priority to monitor. Okay, so once again, before looking at the options, always think priority. So for priority, think what kills the patient or the client the fastest. Now, before looking at the options, think of the number one thing that can kill this client. So using our memory tricks, P for potassium, this is priority, since it pumps the heart and the muscles. So for low potassium, just think low pumps. We get cardiac dysrhythmias, namely flat T waves, ST depression, and a funky little U wave. Now looking for our options, what will kill the client? So option A, paresthesia, numbness and tingling. No, this is incorrect. This is not going to kill the client. Now B, muscle cramps. No, these may be painful, but again, not going to kill the client. Now C is agitation. This one is very close, but it's incorrect. I can see if you thought brain damage here, but no, that's more for low sodium, that hyponatremia with cerebral edema. Now D is the most correct. Dysrhythmias, yes, as we outlined above, because potassium is priority because it pumps the heart and the muscles. Now question 2, the nurse is caring for a client with renal failure. Upon assessment, the nurse notes muscle twitching and tetany, including flexion of the wrist when a blood pressure cuff is applied. Which electrolyte imbalance does the nurse suspect? So once again, pause the screen and try your best to answer this question in about 60 seconds or less. Okay, so let's break this question down. You should always look at the key terms first. So this client has a key term, renal failure, basically kidney failure. And you know that the kidneys are the washing machines of the body, helping to wash out and filter waste from the body and into the potty. So we know that the client has broken washer machines and can't wash the blood. So the assessment findings is twitching and tetany with a key term, flexion of the wrist with a blood pressure cuff on. This is Trousseau's sign, the arm twerk with the blood pressure cuff on. Now, this is a big manifestation that you should know for low calcium, that hypocalcemia. Now the question is asking for which electrolyte imbalance does the nurse suspect? So let's look at the options here. Well, we're looking for hypocalcemia, right? That low calcium. But we can't really see it on the answer options. But we do see high phosphate, that hyperphosphatemia in option A. So this must be the correct option. Now, this was really tricky, but it's correct. Because as you know, when calcium is low, then phosphate is high. And these two have an inverse relationship. So it basically suffices for hypocalcemia in this case. Now, B, C, and D are incorrect. Because hyperkalemia, that is high potassium. We would expect high pumps in the heart, like dysrhythmias. And hypercalcemia in option C is incorrect. Now this was close, but it's wrong, because we would expect kidney stones, moans, and groans. And D, that hyponatremia, this is low sodium, which is incorrect, because we'd expect the client to show signs of cerebral edema and brain swelling, which one of the first signs is agitation and new mental status changes. Now moving on to question 3. The nurse is caring for a client with phosphorus level of 5.8. Which additional electrolyte imbalance will the nurse assess for this client? Will the nurse assess? Pause the screen and try your best to answer this question. Let's break it down. You should have answered this question like this. First things first, locate the key terms. So phosphorus level of 5.8, we know that the normal is between 3.0 and 4.5. So 5.8 is super high. Now the question asks, which additional electrolyte imbalance will the nurse assess for? Before looking at the options, just think about high phosphorus, that hyperphosphatemia. So what do you know about it? Well, once again, high phosphate equals low calcium, right? They always work opposite of one another. So let's look at our answer options. Option C would be the most correct, that hypocalcemia. Now, this is the most correct because low calcium, that hypo means low, so hypocalcemia is that low calcium, which makes sense because phosphorus is high due to that inverse relationship. Now, moving on to question 4. The nurse caring for a client with hypoparathyroidism will monitor for which manifestation of hypocalcemia. So once again, pause the screen, do your best to answer this question in about 60 seconds or less. Okay, let's break it down. First, we locate the key terms. So hypoparathyroidism means that low parathyroid. So the memory trick, PTH, parathyroid hormone, we know PTH, puts the calcium high in the blood. So low PTH, we have low calcium, right? And the question's asking for manifestations or signs and symptoms of that low calcium, that hypocalcemia. So before looking at the options, always think of the top 2 signs for any electrolyte imbalance. In this case, for that low calcium, remember, calcium contracts and calms the muscles. So with low calcium, we have low and loose muscles, low calm and very spastic and twitchy. So we see Trousseau sign and tetany with muscle spasms, as well as Vostics or Chavostics. So you must know these time and time again for nearly every exam for low calcium. Trust me, they're top tested. Okay, now looking at our options here. Option A, changes in level of consciousness. No, we're looking for low and loose muscles. This would be true of cerebral edema, that brain swelling with hyponatremia. Now B, muscle twitching and tetany. Yes, this is correct. The key term here is tetany. Muscle spasms all over. Very twitchy. Now C, paresthesia and bradycardia. This was close, but it's incorrect. Paresthesia is that numbness and tingling, and bradycardia, as you know, that low heart rate below 60. This would be more true for potassium that pumps the heart and the muscles, making everything cramp up. Now D, hypertension and numbness and tingling is incorrect. We're looking for muscle twitching with that low loose body with hypocalcemia. Now moving on to question 5, our last one here. The nurse is assessing a 25-year-old client who presents to the emergency department with reports of severe muscle cramps, nausea and vomiting, and a worsening headache, which began following a 10-mile jog in high temperatures. Which electrolyte imbalance does the nurse suspect based on this client's presentation and history? So pause the screen and do your best. You got 60 seconds. All right, so let's break it down. The key terms in this question is the client presents with severe muscle cramps, nausea and vomiting, which sounds like any electrolyte imbalance. But another key term is the worsening headache. So this must be hyponatremia, that low sodium for cerebral edema. But let's not get too ahead of ourselves. So following a 10-mile jog in the key term, high temperatures. So we have to think very sweaty and very dehydrated, maybe even a heat stroke, right? So the question's asking for which electrolyte imbalance to suspect. So before looking at the options for answering, again, think about the key terms, headache and severe muscle cramps, along with sweating from a jog in the extreme heat. So in this case, we gotta think low sodium, that hyponatremia, right? So let's look at our options. Option A, that hypercalcemia, is incorrect. This is high potassium. So we'd expect high pumps inside the heart. And the question doesn't say anything about dysrhythmias or even hypertension, right? Now B, hypochloremia, this was really close, but no, it's wrong. So it's true that low chloride mimics sodium. But when given the option for low sodium or low chloride, sodium usually always wins here. Now next is hypercalcemia. No, this is incorrect because we would expect high calm inside the body with stones, moans, and groans, specifically kidney stones and constipation. Now D is the most correct here based on the key terms. So headache and severe muscle cramps, along with jogging in extreme heat, which gives it away that it should be low sodium, that hyponatremia. All right, that wraps it up. Thank you so much for watching.